Thank you. Well, welcome everybody. People are still arriving, so welcome to our session on a seat at the table, diversity, equity, and inclusion through the lens of disability. I am Shelley Cohen-Conrad, the director for the Center for Excellence in Collaborative Education. We've been looking forward to this knowledge exchange for quite some time now, and we're going to have a lively conversation and with our presenters, our panelists, and with each other. As part of my introduction, I just want to remind you that to please be respectful in your communications, and please be active when you get into the breakout rooms. I know some of you get a little trepidatious going into the breakout rooms, and some of you don't even make it into the breakout rooms. We're going to really ask you today to be part of those sessions because you're going to meet amazing people have incredible conversations. I've put this in the chat, but I want to remind folks that you can enable auto captioning by clicking the button at the bottom of the screen. And if you have any other questions or needs around accommodations, Michelle Cody is in the chat and she will help you with that. And I just want to say to you, we've learned an awful lot from this panel already. So thank you so much. And we want you to be curious, compassionate, interested, and involved. So it is my great pleasure to do the introduction for our opening remarks. We have Shannon Zlatkowski here today, very excited. She is the Assistant Provost for Diversity, Equity, and Inclusion at the University of New England. For those of you who haven't met her yet, you are in for a delightful surprise. So Shannon, thank you so much.
Thank you, Shelley. And it's so wonderful to see so many folks have joined this already. It's an honor to be welcoming you all to this event. As Shelley said, my name is Shannon Zlatkowski. I use she, her pronouns. Excuse me. I also acknowledge that not everyone is ready or able to share pronouns, and I respect your choice on that. For visual reference, I present as white and feminine, and I'm wearing dark-rimmed glasses and a very springy peach shirt. I will start by sharing a quote by Judy Heumann, who sadly passed away recently. She is often noted as the mother of the disability rights movement. She says, "Change never happens at the pace we think it should. It happens over years of people joining together, strategizing, sharing, and pulling all the levers they possibly can. Gradually, excruciatingly slowly, things start to happen. And then suddenly, seemingly out of the blue, something will tip." When I was thinking about opening remarks, I was thinking about tipping points for me that thrust me further into disability advocacy. And as I have spoken to folks all over UNE, I've shared that sometimes disability and ability are not included in the DEI umbrella. It is absolutely a priority for me and my office that is the case. So I'm so honored to be here. A couple of tipping points that impacted me included a near fatal pregnancy with my daughter that led to severe PTSD and postpartum depression. Later, my son was diagnosed with ADHD and generalized anxiety disorder. There also a time when a dear friend and supervisee with profound hearing loss navigated the pandemic world, which overnight became unwelcoming for many people who are deaf or who have hearing loss because of masking. I will share two brief stories, though, that underscore the importance of this work. First is about my Uncle Earl, who survived a horrific car accident, had permanent paralysis, had to relearn how to breathe, swallow, talk, and move. And I continue to be very close with him. And he was at Spalding Rehab Clinic in Boston. And his wife, my aunt, is full Italian. He loves Italian food. And so after he had gone through a really rigorous recovery, he was allowed to go out into the world. And so we took him to the North End. And he was in a wheelchair. He had a frozen shoulder, which meant that his shoulder was kind of perpetually up to his ear. And he looked a little disheveled. He had gone through, months and months of OT and PT. And we were trying to navigate in a wheelchair around the North End, which, if anybody knows the North End, it's all cobblestone brick, not a lot of clearance for wheelchairs. But that wasn't the worst part. The worst part is that people would not look at him. They would look at me, they would look at my daughter, but they would not look at him. And I thought, what a lack of humanity. And he just wanted to feel dignified as he was out. The second quick example is that when I worked in residence life, I would walk around on move-in day. Students would be moving in, their families would be moving in, and there was a man who had, he was in a wheelchair, and he was sitting under a tree, and it was this beautiful sunny day. And I walked up to him and I crouched down and I introduced myself, and he started crying, and I said, "I'm so sorry." And he said, "You're the first person that has talked to me today." Because people were scared. He had some limbs amputated. And so, again, these are the moments in my life where I think about how very important it is that we see and treat and hear people with full dignity. So I'm so thrilled that there's so many people here. I cannot wait for you all to hear from our panelists. Thank you for the work that you will do. We are the people who will change this world for the better. As Judy Heumann said, we are the leaders of inclusiveness and community of love, equity, and justice. So next, I would like to welcome Chris Delenick. Chris and I had a wonderful chat yesterday about this work weaving into DEI, and I'm so excited for our partnership. Chris is an assistant clinical professor in the Department of Occupational Therapy with over 20 years of practice. Welcome, Chris.
Thank you very much, Shannon. I'm so happy to be here. I'm noticing in kind of behind the scenes text messages that right now we have over 160 participants by Zoom, and I'll be honest, I'm touched by that sheer number and sheer volume of turnout, and it underscores the importance and the significance of our conversation for today. So with that being said, I want to introduce our panelists, just go over kind of who they are and let them introduce themselves. We have three guests from the community joining us today. I can't thank them enough for their time and for their expertise that they'll bring to our discussion today. So we have Dr. David Barnwell, we have Kings Floyd, and we have Amy Sneerson. And at this point, I'll turn the floor over to the three of those folks and allow them to kind of give the brief background of kind of who they are and what they bring to this discussion.
Ladies first.
Okay, well, I can't see your little box, Kings. So this is Amy. I'm going to go first. My name's Amy Sneerson. I am the executive director of the Maine Human Rights Commission. For those of you who have not heard of that organization, I'm glad to tell you what it is. It's the state agency that enforces the state of Maine's anti-discrimination law, which protects folks based on disability, along with a number of other protected classes in employment, housing, places of public accommodation, education, and extension of credit. And it applies statewide in Maine. It doesn't matter how big or small your employer or housing provider is. That's my job, and it has been for 12 years. I've also done work. I'm an attorney. I've done work for almost 30 years in litigation and other civil rights settings, nonprofits, and Attorney General office. And I'm really excited to be here. Thank you so much. And I have a cold.
Thank you, Amy, and thank you, David, and thank you, everyone at UNE and University of New Haven for joining us. Hi, my name is Kings Floyd. My pronouns are she, her. I present as a white woman with brown hair who uses a red and black power wheelchair. I am the Research and Policy Associate of the Disability Economic Justice Collaborative at the Century Foundation in Washington, D.C., and I am incredibly pleased to be here.
Good morning, David Barnwell with the IRIS Network. I want to thank you all for the opportunity to speak to you. I'm with the IRIS Network in Portland, Maine, where we primarily work with individuals who are blind or visually impaired, providing vocational rehabilitation opportunities, and we're growing also into the employment arena as well. We do serve outside of the state of Maine, to include New Hampshire, Massachusetts, state of New York, and even some areas. We've had an occasion to have people from Oklahoma, believe it or not. We're so pleased to be able to share our knowledge with you and learn some things from you as well today. Thank you.
Well, thank you to everyone on our panel again for being here. So I just wanted to provide a brief outline of kind of what we're going to go through for today. Our first couple of topics, we'll discuss, what exactly is a disability, and we'll use the Americans with Disabilities Act, or ADA, as a framework for that discussion. We'll talk about DEI, diversity, equity, and inclusion efforts and conversations that are focused around disability or that are inclusive of disability, whether those conversations and efforts are taking place at home, whatever home is for you, and as well as in the community. We'll have a breakout session. When we return from that breakout session, we'll talk about critical issues, and we'll have some thoughts on those. We'll talk about advocacy and what exactly that looks like from without, and it's from external to an institution, from within an institution, being an ally. Have another breakout session, and then pull back together to do our final thoughts and a wrap up. So first, on the title for this presentation, we have a quote here, Elizabeth Warren: "If you don't have a seat at the table, you're probably on the menu," and that is attributed to a lot of different folks. Professor Warren, Senator Warren, is known for that. I first heard it through the Secretary of State for Maine, Matthew Dunlap, but the idea being critical decisions that are happening at these tables, so to speak, have often lacked disability voices at them. So we wanted to bring that to the forefront and bring that to really a discussion point for today. So that's a little background on that title. Using the Americans with Disabilities Act as our framework for a discussion, some important things to note: it was signed into law a good deal of time ago, so July 26th of 1990, by President George Herbert Walker Bush. Front and center in the photo on your screen. The ADA has 5 titles that you see listed here, ranging from employment to telecommunications to state and local government, public accommodations, and then this kind of catch-all Title V miscellaneous. So our first discussion point, talking about disability, if we move to our next slide, the first discussion point that I want to turn to our panelists to touch on is this idea of what exactly is a disability. And I'm using the ADA as a framework, not because it offers the best, not even because it offers a solid, and I use definition loosely here, for disability, but I've underscored here on the slide what is included in ADA as a disability. So a physical or mental impairment that substantially limits one or more major life activities, a record of having an impairment, or you're regarded as having such an impairment. Now, I'll make a note here, and our panelists will certainly provide further insight on this. There are a wide variety of definitions of disability across different aspects of federal government, state government, etc. And I also want to note that taken as an aggregate, as a group, people with disabilities in the United States represent the largest minority group in the country. It's also a minority group that anyone can join at any point in their lives. So our panelists, I'd like you to touch on this point, the pros and cons of the ADA definition, your experiences around how disability is defined, for better or worse.
Well, I'll hop in and just sort of lob in something here. I'm sure that everyone has a point. In our particular world, you mentioned the definition by ADA, or that there were other definitions. In some instances, there's departments we deal with that have no definition. They do not want to touch this because defining it is such a prickly pear. And so to try to have conversations across multiple departments at the federal and state level where they do not have a cohesive disability definition, does create challenges. And so I think it's very important that as we come together, an organization like this, I think you said there was 160 plus, as we all are touching these different areas, be it the titles or the different areas that we touch in our world, that we work collaboratively to make sure that we're able to insert aspects that are going to make the life easier for those peers of ours who may be working in areas that don't have definitions that are very clear. It really stymies the amount of work that can be done around DEI and the disability community when you are at the lowest rung trying to just get a definition of who can participate. And I'll leave it at that and let some of my other peers hop in on that, because I know that they certainly have a wealth of knowledge on that as well.
Thank you, David. Amy, I saw you had your hand raised. Go ahead.
I did, and I'm going to jump in there ahead of Kings just because I feel really strongly about this definitional issue. And there's a reason, because the ADA is amazing. But I also want to let folks know, whether you're in Maine or you're in New Hampshire, wherever you are, every state has their own state law that is at least as protective as the ADA, if not more. Maine Human Rights Act, our protections based on disability are much broader than the ADA, and that's on purpose. There's like 8 different possible ways to qualify as a person with a disability and get protections of the law. But would you know that if you were just a random person? Probably not, unless you were studying the law or you had a family member or you yourself were advocating for disability benefits. But I think it's important to let folks know that as amazing as the ADA is, it's a floor of protection. And states can and do offer more protection, and also did so far before the federal government. Maine's Human Rights Act started protecting based on disability in 1974. So keep an eye on your state law for protections, because that is going to apply across state protections, just like the ADA applies across federal protections. And you shouldn't have to argue, theoretically, that you are entitled to the law's protections because you have a disability. Whatever disability definition is being used, it should, theoretically, you saying you have a disability and need accommodations or have an issue, that should get you in the door. But it's not always that simple, unfortunately. And that's why agencies like mine and the IRIS Network and King's organization, that's why we exist, to help folks when just asserting that you have a disability or your family member does or your client does and that you need something, if that is not respected, that's why all of our organizations, that's one of the reasons why our organizations exist. Thanks.
Yeah, they're all fantastic points. Kings, would you like to jump in?
Sure. So as this is Kings, as someone that's worked in multiple government agencies, none of which have had the exact same definition by agency of disability itself, there is not a standardized way of looking at disability. Stepping back into an even more broad perspective, there are different mentalities with which we can look at disability. We are very much in a medical setting with UNE and University of New Haven. So we are probably using the medical model of disability, which looks as disabled people as patients that need care. And we have to fit those individuals into our healthcare system, but we may not view it in any other outside system, whether that's employment, transportation, housing, viewing disability as a specific medical issue. If you move more towards the social model, which suggests that the world around us is built inaccessibly, and the problem does not lie with the individual directly, but with the attitude of the community, you start to view the definition of disability in a different way. I think later in this conversation, we'll get into really what accessibility means, and whether we are viewing it as a legal checkmark that we must do, or a philosophy with which we can approach our work.
And if I can just tag on to King's and Amy's points, I think that it's important that we also take this venue where all of us together who are working and pulling the rope the same way, to remember each other that are on here and use each other as a resource, whether or not we're in a social environment or one that's in a medical model. We might need some guidance, and you have 160 plus individuals here that are looking at this particular issue. So I would encourage each of you, I know I will be, taking names and contacts information, because there will come a time when I may have to lean upon one, if not many of you, to help guide me in your particular expertise area. So I would strongly encourage y'all to do that. I know I will.
Thank you, David. And thank you, Kings and Amy, for that. I want to touch base on the idea of the conversations or the efforts that are taking place in the community, at home, around diversity, equity, and inclusion. What in your experience, for the panelists, what in your experience have you seen? Have you taken part in? Have you participated in? How has that gone? How has it worked? What's missing? Those type of big questions around, how exactly is disability being included in DEI efforts?
I'm gonna jump in, Chris. This is Kings. I'm gonna point out a couple of things, and we are talking about DEI right now as diversity, equity, inclusion. As someone that has been working in not only government, but nonprofit for some time now, I have always referred to it as DEIA, which is diversity, equity, inclusion, and accessibility. I know there are also some organizations that say a DEIA-B and include a belonging at the end. I do want to note that UNE does not have an A at the end of their DEI department. And so even in just the acronym acknowledgement, disability may not be specifically represented. I also want to flag that we are a panel that bring many diversities to the table. Unfortunately, we all come from a white background. And so we do not have the perspective of disabled people of color on this panel to bring the lens of intersectionality as it relates to race and disability.
King's, great point. I think that one of the things that when you run an organization, I bet Amy does this as well, and I know King's, you run into this when you're dealing with different departments, is you have to have a just as diverse a group of individuals that work with you.
Agreed.
I'm very proud to be able to say the team that works both from race, sex, disability, and we're very proud of that, because I think it really provides a more well-rounded direction when we're serving individuals. And I think it's great you bring that. But I will point out, yesterday when we discussed, I also liked your other acronym that you used, JEDI, the one that incorporated justice. I thought that was, I've already shared that with at least 20 or 22 different individuals who are Star Wars fans and enjoyed the acronym.
Yes, justice, equity, diversity, and inclusion.
Indeed.
This is Amy. That's awesome. I'm totally going to use that. And I would just say a lot of my experience in terms of the issue of accessibility and inclusion on the big picture discussion as part of DEI with respect to people with disabilities came from my work with a nonprofit that worked with people that supported people in lots of different ways who were deaf, hard of hearing, or late deafened. And the deaf community in particular has a tremendous amount of experience organizing and advocating for itself in a way that I found not a lot of other communities of people with disabilities has. So I think my experience of watching that group and being part of that group fighting for inclusion and accessibility may not be very representative of a lot of other communities, because it was very cohesive. And even within that community of people who could not hear for some reason, the big D deaf community didn't necessarily include the little D deaf or hard of hearing or late deafened. So it was a very interesting introduction to the world of advocacy by and for people with disabilities and ableism. But at the same time, that community was not necessarily interested in partnering with a lot of other communities of people with disabilities. So the ableism discussion, it seems to me, depends a lot on which community you're talking to at the time and what inclusion and accessibility looks like. For some people, it is modifications like closed captioning or ramps or transcriptions or ASL interpreters, or depending on what it is, what you're talking about and what inclusion looks like is very, very different. And I found, so just for the folks who were not on, we were preparing for this presentation just beforehand, and we found as we were talking that we were discussing closed captioning in a way that a lot of people, even in this group, were not necessarily familiar with. And that was really eye-opening to, I think, all of us, that in a group of people preparing to talk about disability and inclusion, we were still learning from one another. So I want to say that in my experience also, we represent people who are deaf, hard of hearing, Black, gay, trans, whatever, Muslim, Asian. We cover the gamut of people who are in protected classes because of innate characteristics. And across the board, I have found that people just want to be seen as included and as part of a discussion. And they know what they need. So if they ask you for something that they need, they probably need it. They're probably not asking to be difficult, regardless of the conversation. And if you're not sure what they need, just ask. So that's my overall plea.
I'm going to jump in there, Amy, and just clarify a few of the terms you used, because I know what they mean, but I want to make sure that our audience does. So little d deaf and big D deaf, the difference between those is the cultural embodiment of the deaf culture, as well as potentially the knowledge of American Sign Language. And ableism, as I'm sure many of you are familiar with, is the idea that people with disabilities are somehow less than non-disabled individuals.
And I want to hop in and say, Amy, I think I want to pick up on one of the words you said, which was very important, that the cohesiveness of the community of people who are deaf. You're exactly right. I work within the group of people who are blind and visually impaired primarily. And in that area, what I have noticed is there's a lack of cohesiveness. Why? I couldn't really tell you. I know we all are working together to try to bring together different agencies that speak the same language. Having a definition that's not adopted universally certainly is one issue, and other things. But to imagine going to someone to ask for help, either federal, state, or local level, from a policy perspective, or from any type of perspective, quite frankly, and you don't have a cohesive unit, you can imagine how that's received. So certainly take the messages from the community of people who are deaf and have a cohesive unit and a message that goes out to the community so that you can get a little bit more return on your investment of time from advocacy perspective, especially.
Yeah, thank you all. This is great. One thing I do want to note, I think we have quite a bit of attendees who are in medical fields already, who are preparing to enter medical fields as a student, and going back, if I can, for just a moment, and asking you as panelists, the idea of disability and the idea of a diagnosis, and where those two overlap and where they might differ.
Chris, I can jump in.
Yeah.
This is Kings. So I will share a little bit about my personal history with my disability, and it will kind of set up for you an understanding of diagnosis in a new way, I hope. So when I was born in Boston Children's Hospital in Boston. I'm very familiar with the North End cobblestones. I shuddered when I heard that. Born and raised there. When I was born, the doctors acknowledged within 2 days that I was super floppy. I had a muscle biopsy taken, and I was diagnosed with LAMA2 partial myrcene deficient muscular dystrophy, which is a mouthful. So we're just going to call it muscular dystrophy. It's a fairly rare kind of muscular dystrophy, even within the congenital or from birth muscular dystrophy diagnoses. And so, I have been living with this my entire life. I was then diagnosed at 10 with epilepsy and have been dealing with that my entire life, as well as the complications that brings on. I have always been incredibly active in my community and in fighting for the things that I believe in, but I have somehow never managed to be completely organized about the whole entire thing. I have 90% of my ish together, but my 10% somehow always escapes me. And in COVID, it became so much worse. Not seeing people, not going out, not being engaged with the community, with the things that I'm passionate about. And I was spiraling a little bit. And I'm totally not afraid to say that. So I was, getting mental health situated. I was checking in with my doctor, and she said, "Hey, maybe you should take an ADHD test." Like, just throwing that out there. And I was like, "Oh, okay, but I don't think I have ADHD. I know I have all of these other things, but I got great grades in school. I'm, good in my career. Yeah, that's probably not true." And she was like, just take it anyways. Just check in. And I took it, and I have ADHD. Okay, wow. Very, very late, as in 2 months ago diagnosis. I've had that likely my entire life, and it's only now been diagnosed. And yet I have been accommodating for that disability my entire life. And so recognizing what you need versus diagnosing your disability, there is a very clear distinction between those two terms.
Thank you, Kings. That's powerful, and I think really important for the audience to hear.
Yeah, I would just add on there, this is Amy, is that from the Human Rights Commission perspective, we are looking, it starts from the perspective of someone having a disability that they can document. That's what gets you in the door for arguing that you were discriminated against. The laws that we're talking about apply to protect people from being treated differently or worse if they have a disability. And Chris talked about the ADA definition. The MHRA, the Maine law, has a broader definition, but they are based on essentially a medical model, right? Saying that if you were treated differently or worse because you have a disability that qualifies, right? And the thing that happened to you that you think was wrong happened because of your disability. That's sort of the legal definition of discrimination, right? And if there's a way it could have been avoided or accommodated. And there's lots of theories of the law, but essentially they boil down to, do you have what is medically considered a disability? And did something bad happen to you because of the disability? And a lot of times there's a disconnect between, a lot of people, I think, have, and like you said, Chris, anyone can join this protected class, right? Anyone can develop a disability or have something happen to them or be born with something that constitutes a disability, but it's the connection under the law. The connection has to be that the bad thing at your job or your housing or in what's called a place of public accommodation, right? A doctor's office or a courthouse or a movie theater, that the thing happened to you because of your disability. And that's really, it's sort of a mix, right? It's got the medical issue, but also then the cultural understanding of what disability is. A lot of disabilities are invisible, right? And people are asking for accommodation when the reason that they need it is not immediately evident to people. So it puts people in a very difficult position of having to tell people what you need and sometimes why. And that is very private, very personal. Not everybody wants to have to explain to Jim at their dentist office why they need something for their panic attacks. So I would say in the Human Rights Commission, we see things sort of in both the medical model and sort of the societal ableist, what do you look like? What does it seem like model?
So I hate to interrupt this conversation, but it's because it's amazing and I have incredible gratitude for it. But we're ready to go into breakout sessions, if that's okay with our panelists, and we can continue this conversation as we move along. So I'm going to invite everybody, all 176 plus you, please stay and go into the breakout sessions. And because we have a phenomenal number of breakout sessions, some of them will not have facilitators. So we're going to ask you to please invite each other and be curious about each other and think about these prompts that we put out here for you. And I do want to make a formal welcome to our University of New Haven students and faculty who are joining us today. So first and foremost, be curious. Introduce yourselves and your professions to each other. And what have you learned already today? And how does that match with the kind of information you have in your curriculum about disabilities and disability rights? What DEI tables, and I want to say now DEI AB tables, exist that include or lack disability representation? We've been made very aware of that today. And what efforts and discussions have you witnessed or engaged in that included disability in the context of DEI AB? And so we're going to break into our rooms and we're going to be looking forward to lively discussion for about 10 minutes, right? Okay, let's go. Yes, so we had quite a lively discussion and I'm inviting everyone in your various breakout rooms to put stuff in the chat or if you'd like to light up and talk about what went on in your breakout session, that would be awesome. I'd love Windray to talk a little bit about what breakout session 1, what we discussed.
Okay, thank you, Shelley. So in breakout room 1, we basically discussed first of all, our thoughts on how well our respective curriculums handle providing platforms like this to bring awareness to individuals with disabilities and to help sensitize us to their experience and teach us how to, deal with that in our careers moving forward. We also discussed the need for better accessibility for individuals with disability on our campuses. Some examples, I believe it was Amanda who shared that there is a lift on the Portland campus. I believe she's a dental hygiene student, and that it does not work properly, and that patients have complained several times that they feel like they're put on the spotlight when they come in, and that they have to use this lift that doesn't work properly, and that is partly embarrassing. We've also discussed with another student on this panel here, Lizzie, who said that, she doesn't like that she has difficulty sometimes navigating campus, and that she feels that there need to be more, there should be better accessibility for her. So we basically discussed that, people can feel, a bit ostracized or partly embarrassed, or like they're not catered to on campus, and that we need to do more to have them feel welcomed and to have their needs catered to on campus so that they feel more comfortable and included.
Thank you, Windry. And I want to go back to the terminology of belonging, not, that they belong, that it isn't something special. It's just a part of. Shannon, your group was made up of UNE students in medically related programs. You want to say something about what went on in your group?
Sure. We had a great discussion about the importance of simulation programs and the standardized patient program, making sure that they represent the community, and whether it's, again, through kind of simulation or actually inviting patients, folks with disabilities to be part of the standardized patient program is really important. We also talked a little bit about accessibility services on college campuses at UNE, and are they situated in the right place, given their responsibility to carry out kind of legal and kind of procedural pieces. But no matter what, this work is about belonging and inclusion. And so there's room for advocacy for disability issues in DEI.
Great. Thank you. And Marissa, from room 5, do you want to talk to the group here?
Yeah, I can share a little bit. We had all UNE students. We had one nursing, one dental hygiene, one PT, and then the rest were all medical students. And we talked a lot about how disability is talked about and taught in the different professions. And then we kind of got into an interesting conversation about like advocacy through the lifespan, and how like ADA and IDEA can be really helpful for individuals throughout, early intervention and school-based settings. But then King's was really awesome and taught us kind of about the service cliff, which is where when, people are phased out of services out after school, there's an issue with continuing to obtain services throughout the lifetime. And then we talked a lot about advocacy in different settings, and like being an advocate as a healthcare provider, and how like you can do that kind of, and just how to set up our practice settings to be more accommodating.
Fantastic, Marissa. Thank you so much. Chris, are we ready to move on, or can we do one more?
I think we can do one more, sure. I should say, are you talking to me, Chris, or Chris Hall?
I have to delineate the Chris's. So I was looking at the organizer, Chris, but if Chris H is okay with Chris D, shall we do one more?
Yes, please. I noticed that UNH has made some comments in the chat.
Would you like to share those?
So Susan from UNH was mentioning that they were discussing the need for inclusion in the workplace and developing paths for individuals with different abilities to have access to employment there, and also the global differences in disability rights. So outside of the United States, how is it addressed?
Yeah, I just want to mention in our group, we also talked about discrimination both on the larger systems level, which people talked about, accessibility, non-accessibility, but also in the social level amongst peers, different ways people, especially younger people with disabilities, are excluded or ignored or, talked over in situations where their peers don't know how to accept them or are comfortable being with them. I do want to open just quickly for our panelists. Any feedback you'd like to give from your experience in the breakout room? I saw both David and Amy had comments.
I wish that there had been a little bit more time. I think Ed really hit on something at the end of our conversation, not to take away from the earlier part of the conversation, but really how we're interacting and approaching the undiagnosed individuals. And I think that warranted a lot more conversation that hopefully we can get back around to, because that, as a general rule, is probably how we're going to interact with a fair number of people that we have no idea have been diagnosed with a disability, and yet demand the same respects as anyone else.
Great, thank you.
I would tack on to that. The folks in room 6 were fantastic, brought a lot of their own experiences, seeing family and friends and people on campus with them, navigate the challenges both in school and outside of school of inclusion and accessibility. And I thought it was really powerful. One of the last thing we left on was someone who already is out working in the field and has been, reminding folks that they were really struck by the tendency that medical providers, and a lot of folks who are here today are in training to become or already are medical providers, folks in the community to, when presented with someone in their exam room or in their service area who has a disability, the tendency, if you're not sure what to do, to talk to the able-bodied person that you know how to communicate with, and how dehumanizing that can be for someone with a disability. You're right there and you know what you need, and to have a provider pivot to your staff member and just to be aware of the humanity and the dignity and the autonomy of people with disabilities, I thought it was really powerful.
Great. King's takeaway is we need to continue this conversation. And I just want to remind folks that some of our participants have classes at 1, so you may see some people, some of the population diminish, but the interest is there. So I'll pass it back to Christy.
Thank you, Shelley. I really appreciate that. And I appreciate our panelists for moderating discussion rooms and the great conversations that took place in those breakout rooms. And the idea that we've heard and from King's and echoed, the idea of like, this is a conversation and it's not a one-off. It needs to continue. Whether it was the points that we were talking about in earlier sections of our session today, or the ones we're going to be transitioning into, the idea here is, it's a terrible analogy, but it's one I think that is apt. It's the idea of everybody knows, these Where's Waldo, and you look at these images, and once you found Waldo, you can't unsee him. So some of these issues that we have talked about, that we are talking about as healthcare providers, as future healthcare providers, as people, now that you've seen them, so to speak, or heard them, you can't unsee or unhear them. It's up to you what you do with that. So we have some of these critical issues here, and they were brought up in our discussions from the breakout rooms. And there's a lot of overlap. If you look at a Venn diagram, some of these are complete circles. And I would say all of them have some type of overlap and interchange here. So whether they're policy-based, so things like employment, healthcare, transportation, housing, et cetera, this is not a comprehensive list by any means, or they can be construed as more of or defined as more of a value-based issue. Things like representation, seeing someone who looks like you on a college campus or in your workplace, or the idea of accessibility, from the very, very granular, can I literally get into a building? If I'm entering an exam room with my physician and I'm a person who uses a wheelchair as a primary means of mobility, does that medical provider have a scale that can accommodate my wheelchair? Really granular issue of accessibility that also touches on healthcare and so many other things. So I want to turn to the panel. if you look at these issues, what really jumps out to you?
One of the things I'd like to bring up is a lot of people talk about strategy. Strategy is great. Then you have to act on it. And that's where I see a lot of people have conversations, and then the moving to tactical or moving to implementation is where you see the drop off. And my hope is that this conversation transitions into a conversation of activism, moving towards what can we specifically do around these things. For instance, you should include people, like you use the example of, do you have a wheelchair ramp that gets to you, right? So if I were going to go, no, I don't, but I want to make sure I do, it would probably behoove me to interact with someone who is in a wheelchair, as opposed to I'm not. So I should probably not just be making a decision. It should be an inclusive process. It's in the term, right? It should be something that we seek out the individuals and have them actively participate in the solution. And that's the part that I think if we go away from this and we say, here are our strategies, and we start thinking about how we implement it, I think that's going to be the key, because that's how we have to move the needle, is go from strategy to implementation. And that is where, again, most of us fail.
So I was waiting for Kings, but since I don't hear her yet, I'm going to jump in and say, I am very encouraged to see all of you here today to talk about this, because I can think over my 12 years in the current job that I'm in, I think I've had a disability focused group like this maybe 2 or 3 times. So this is very encouraging. And I would say to each and every one of you, right, my job is focused on getting complaints where things went wrong. And someone didn't get access or didn't get included. And so I would say every single one of you can make a difference wherever you work, wherever you're training. It is possible for each of you to make a difference by speaking up. When you see something where someone needs an accommodation or doesn't have what they need, you may not realize it, but you have so much power just by speaking up, just by raising your hand in your clinical practice or in your classroom or in a medical setting to say, hey, what about this? Is there a reason why we're not doing this? Or it seems like maybe we should be talking about this. You have so much power, and I'm encouraging you to just consider speaking up and using it.
Hear, hear.
I will jump on that. If this is King's, if the moral argument of making everyone feel included and having everyone participate is not enough for you, and you want a strictly numbers approach, it is on average 30 times more expensive to go back and create an accommodation than it is to put the accommodation in the first place. And so in terms of economic potential, not to mention the fact 1 in 4 Americans has a disability, 1 in 10 Americans has a mobility disability of some kind. From a financial standpoint, it behooves everyone to think of accessibility from the jump.
Keeping on the accessibility theme, as far as accessibility and drawing that line to things like employment, and maybe even somewhere along the way, including transportation, how do you view those issues as being linked? And I'll stop there. Go ahead.
So we have a saying at DEJC, the Disability Economic Justice Collaborative, all policy is disability policy. Disability is everywhere. It is the largest minority. You can become disabled at any time, which is not true for any other demographic. And so in some ways, disability touches everything. If people don't have transportation, they can't get to work. If they can't get to work, they can't make money. If they can't make money, they can't rent or pay for personal care assistance or pay their bills, which then becomes a homelessness problem, which then becomes a service provider problem, as well as just a human being is not cared for. And so when we say every policy is disability policy, it's not just the 4 that we have listed here, education, employment, healthcare, and transportation. It's everything. It's sustainability. It is disaster prevention and preparedness. It is community engagement and involvement. I know some people that live in a community like a homeowners association, and the homeowners association was not trying to be accessible. And just from like every different aspect, there are almost no downsides to accessibility as a value and as a practice.
Excellent point. And to your interconnectivity you were talking about and how every policy is disability policy, I encourage you all to look up the Federal Strategic Plan to Prevent and End Homelessness. If you read how they're going to approach that, it reads how you would approach the world I live in, the world that Amy lives in, the world King lives in, and how they're going to, their strategy on how they're going to deal with discrimination in housing, education, employment. These are going to sound familiar. Transportation, accessibility, criminal justice, all these areas, right? And so I think while it is not a completely inclusive, it is an excellent put together document that I think that if you want to look at what could I do next, and I don't even know where to start, I encourage you to pull that off and take a read. It was very enlightening to me to know that there were people who were getting it and realize that while they were applying it to homelessness in this particular case, the applicability to the blindness community, deafness community, any of the groups of individuals with disabilities, you take these same strategies and you apply some of the things they want to accomplish tactically, they can be implemented. And so we're certainly using it as a guidepost, and I encourage you each to pull it off and take a look at it.
Thank you, David. Those are great points. If I stay on the idea of accessibility, and we're going to transition into advocacy for our next kind of discussion, but staying on the issue of accessibility as this we can get really granular about it. One of the things that people might hear frequently, if we're bringing up just really foundational access, is this idea of, well, we don't own the building, we rent, as far as like retail or any type of business, or this idea of, well, we're grandfathered in. The building is in some type of historic preservation, or the what came first, the chicken or the egg kind of idea of, we don't have any customers who need a ramp. And you talk about like this idea of like a self-fulfilling prophecy. If you don't have a ramp, of course you're not going to have people who need a ramp. They can't get into the building. So like how do we address that as just like a really just a basic level of access?
So this is Amy. I'll jump in there because that's what we do all day is assess complaints from people who say, I went to get my hair done at this salon and I couldn't get in, or I asked my landlord to put in a ramp and they said no, or they wouldn't even let me put in a ramp, or that's what we do, right? That's where I live. Talk about a self-fulfilling prophecy, just like you said, Chris. You have a place that doesn't have ramps. People who need wheelchairs or who have mobility issues are going to notice, and they're not going to come. And this doesn't just come up in service providers. This is true for towns, right? Where you have town meetings, where you have voting. What kind of, do you have a phone tree and that's the only way to access your services? And someone said this in the breakout session we were in before. If people just, and we're back to design, right? If businesses planned at the outset, if they had universal design, this would be so much easier to solve. But I would also say that I know from my time in the deaf community, if you are a provider that is actually welcoming, word gets around, people know. And the same thing is true for providers who do not, right? People talk, they know, like they welcome us. They don't care that they have to get interpreters. They will still treat us with dignity. That will get you way more business than you have to worry about.
Mm-hmm. I thank you, Amy. I want to move on to this idea of advocacy. So whether it's I'm part of an institution, I'm part of an organization, I'm a student, I'm an employee, or from the outside, I'm recognizing something in my city or state or town or my community. What does that look like for folks in the audience who don't have a disability? How can they be allies, and how can we advocate?
I have a lot of thoughts about that, but I want to let Kings and David go first.
I can tell you that first off, that there's someone in the community that's not disability that reach out is great. Normally, people, they acknowledge that they'd like to do something, and for some reason, something keeps them from doing that. This is kind of what I was hitting on earlier. We have to make it easier to have a network for people to be able to engage individuals across different disabilities. That's what I found missing in a lot of the communities I've lived in as I've grown up, is they've been well-intentioned individuals, but they didn't know where to start. And I think that agencies like myself and Amy's and others, that we have to be part of that network and continue to make that widely known for the individual that identifies something. And I think one of our peers said something earlier, that speak up, say something, and know where you can speak up. And so if we can bring to the table that we've created this network, maybe some of the people on this cast will be able to become part of that network. So when an individual does speak up, we can tell them exactly where to go and how they can articulate it. So it's not always to your congressman or to your commissioner, but you can go to agencies, you can go to Maine State Housing. These are all these different places you can go based on what it is. And I think that it's incumbent upon us to create the network and then make sure that people are encouraged to continue to speak up.
So thank you, David. I want to just acknowledge that we are due for our second breakout session to talk about some of these exact issues. So if we can get back into our breakout sessions, I guess I want to put this to our panelists, final thoughts, and then see if we have any questions from the audience. But panelists, please take the floor.
I love it. From room 4, talking to my which were a lot of first years, but also we had Ed, who's basketball coach there. He had mentioned a committee that exists, that the students demand this interaction with the university to have this DI inclusion as part of their educational experience. And the fact that they're actively seeking out there, and what a differentiator that's going to be when they go out into the marketplace too, as they're going to their residency and so on and so forth. That is really going to stand out from people who are going to other institutions that haven't had that. It's one thing, you can't write that on your CV, right? This is something that they will see in your practice, the way you interact with individuals. And so it helps them check their biases. And then Ed at the end was saying, we have to demand that we have the interaction. We have these groups who say, let's make sure we have the individuals around the table who we're having conversations with, and demand that, and that we'll see that will help guide the conversations that we have, and ultimately what our solutions are on whatever problem we're dealing with. I thought it was, and I loved our conversation.
Thank you, David. Kings or Amy?
Yeah, this is Kings. I will say one thing, and then I'm actually going to turn it over to our scribe for our group 5, who is Paige. But I will just stress this one point. It is your responsibility to speak up if you see something that is inaccessible. If you see there is people that are not being represented. And so, allyship is active. Paige, you want to give us a readout of some of the main things that our group hit on?
The first thing that we definitely hit on was just like asking the person who has the lived experience for their like opinion or what they want or feel like we need in our society to make improvements is really big, just because like a big fail in our society and like our healthcare system is you kind of just assume what they need instead of asking. And that can be like very belittling. So it's just really important to get their opinion. And then also we talked about just getting involved and being willing to ask for help. So like King said, like recognizing there's a problem is like the first step, but as we know, being like advocating can be really intimidating. So it's like not being afraid to ask for help and guidance to see where you can really start is really important. And then also just being aware of your own prejudices, because doing some self-reflection on your own biases can help improve yourself first. And then once you're aware of that, it's easier to educate people around you and even like your family who might not have the same education that you do, like being in the medical field, or your friends, because not everyone has the same education that we have. So even just starting small scale can make a really huge impact.
Right on. The only thing I would add, my group was great also, but we talked a bit at the end about, again, how challenging it can be for people who have disabilities that are not visible, and how much stigma and shame people still experience, even in very privileged environments, to asking for or acknowledging accommodations, and that I think we can all create much more supportive environments by opening the discussion up. And I think the point that the person just made about examining your own, everybody examining and acknowledging that we all have biases, and it is a fact of human nature that we have them, and it's okay to acknowledge the fact that they exist, but you can't even address them until you acknowledge them. That's true in every protected class characteristic. So if we can stop shaming ourselves and open the conversation, it would make for a much more inclusive environment all around.
So this is Shelley, sadly ending this discussion, and that has been incredible, motivating, hopeful, challenging. And I want to very much thank Chris and Amy and Kings and David for your insight and for your forthrightness. I think it's amazing. Shannon, thank you for your introductions. You were amazing. And I just want to remind everybody to fill out the attendance sheet if you get a chance. And also that our next event will be with the UNE Planetary Health Council to solve Climate 2030 Initiative, climate change in the classroom and beyond. We hope you will be able to attend that. I also want to say a special thank you and bye-bye to our folks at the University of New Haven. Join us again for another one of our knowledge exchanges. So thank you so much, everyone, and for all of you who attended. Thanks so much.
Thank you, everybody.
Thanks for having us.